Hello, my name is Christy Landon and I'm Director of Human Resources for Henry County Public Schools. I want to spend a few minutes talking with you today about our health insurance benefits. Admittedly, it's not the most exciting of topics. However, our health insurance coverage does play a very vital role in most of our lives. As you're probably aware, health insurance costs have been increasing dramatically across the nation for a number of years. In Henry County Public Schools, we've been extremely fortunate not to have had any plan design changes for the past 5 years and to experience only nominal cost increases. Unfortunately, the increases that have been impacting the remainder of the nation have now caught up with us as well. Our costs are up 19% over the past 12 months, and as we've already shared with you, there will be changes to our health insurance plan beginning July 1st of 2019. The purpose of this video is to help you understand how our health insurance works and to give you the resources that you need to use it to your advantage in the most cost-effective manner possible.
For those of us who don't work in the insurance industry, the terminology can be hard to understand. So what do terms like co-insurance, deductibles, and out-of-pocket maximums really mean? Premiums are the monthly amount you pay to purchase health insurance coverage. Henry County Schools offers an amazing benefit by paying for 100% of the monthly health insurance premium for employee-only coverage. Premiums are set for the plan year, so if you pay for dependent coverage, you know before the start of the year what it's going to cost you for the next 12 months. Henry County Schools plan year is the same as the school year, and it runs from July 1 through June 30th of the following year. Copay is the set amount you pay for a healthcare service. Henry County Schools has fixed copays for doctor's visits and prescription drug purchases. The deductible is the amount you pay before health insurance shares the cost of covered services. It's important to remember that not all services are subject to deductibles. For example, you can visit your primary care physician and pay only your copay unless your doctor performs other services for which you may have to satisfy the deductible. Co-insurance is the percentage of cost you pay when you share the cost with insurance. You must satisfy the annual deductible before beginning to use co-insurance for services that are not covered by a simple copay. The out-of-pocket limit is the maximum amount you pay out of pocket before insurance takes over and pays 100% of covered services through the remainder of the year. Your deductible and copays apply towards the out-of-pocket limit. In-network providers are part of the insurance carrier's approved provider network. Non-network, or sometimes called out-of-network providers, are not part of the insurance carrier's network. Anthem has negotiated deep discounts with the health providers included in the Anthem network, so in-network costs are lower. Here's a look at our major benefits. Beginning July 1st, 2019, your copay for an in-network doctor's visit will be $30, and a visit to the specialist will be $50. An online doctor's visit through Anthem's Live Health Online will be $20 per visit. Deductibles do not apply to these visits. Your copay should cover the cost of the visit unless the doctor performs additional tests or lab work. Your in-network deductible will be $1,000 per person or $2,000 per family. The in-network out-of-pocket limit will be $4,500 per person or $9,000 per family. This is actually lower than our current plan, which has separate out-of-pocket limits for medical and prescription drugs. Preventive care visits and immunizations continue to be paid at 100% when using in-network providers and services. In-network emergency room services will cost 20% co-insurance after the medical deductible is met, and prescription drug copays remain the same as they have been in previous years. The benefits I've covered are shown in the middle column and are the costs for using in-network providers. Other than prescription drugs, which cost the same in-network or out-of-network, services from non-network providers cost more, as you see in the right-hand column. For example, if you see a non-network doctor or specialist, your costs will be higher and you'll need to meet the annual deductible and then pay 40% co-insurance, meaning 40% of the cost of the service after meeting deductible. Let's look at a couple of examples. Carol has an appointment with her primary care doctor for her annual physical. That is a preventive visit, and her doctor is in network, so the cost is paid at 100% and Carol pays nothing. Carol then has a visit with a specialist, and she pays a $50 copay for that visit. Her specialist refers her to have an MRI. Carol must meet her annual $1,000 deductible before insurance pays anything toward the MRI, and then she shares the cost and must pay 20% co-insurance. It's early in the year, and she hasn't had any other services yet that applied towards her deductible, so her total cost for the MRI would be $1,120. In the next example, Carol visits the ER before satisfying any of her annual deductible. Please keep in mind that if Carol had already met her annual deductible from the MRI shown in the previous example, she would still owe the 20% co-insurance, but she would not need to resatisfy the annual deductible. Let's talk for a minute about open enrollment. Open enrollment is April 1st through May 10th, 2019. All benefits-eligible employees must attend both a group open enrollment meeting and a one-on-one enrollment meeting. Remember that you cannot make changes during the plan year, so during both meetings it's important to listen carefully and to make well-informed benefit selections. It's also extremely important that you verify all dependent information is correct to make sure the right family members are covered and that you're paying only for the right coverage. Dependent children covered on your health or vision insurance may remain covered until they reach age 26. Dental's a little different. Dependent children covered on your dental insurance may remain covered until age 19 or up to age 23 with proof of full-time student status. If you have a child approaching a maximum age limit, it is your responsibility to notify a member of the Human Resources Department to make sure you don't continue to pay for an uncovered dependent. Other than taxes, benefit premiums are the most expensive payroll deductions for most employees. It's extremely important to make well-informed decisions about the insurance coverage you elect each year, to make sure you choose the right coverage for you and that you have the right dependents covered. The majority of the insurance benefits Henry County Schools offers are part of a Section 125 cafeteria plan. That means that they qualify under the Internal Revenue Tax Code to be deducted from your compensation before you pay taxes. Being pre-taxed doesn't reduce the amount of your premiums, but it does reduce the amount of taxes you pay. Because pre-tax deductions are allowed by the IRS also sets the rules for enrolling in and dropping coverage. Those rules allow you to add or drop coverage only during the annual open enrollment period, or if you experience what's called a qualifying life event. Experiencing a qualifying life event, sometimes also called a qualifying event or a change in status, may open a special 30-day enrollment period from the date of the event, allowing you to make changes to your insurance coverage. Examples of qualifying life events include marriage, divorce, birth or adoption of a child, death of a family member, or loss of other coverage. So what can you do to make the most of your health benefits and to save money where you can? First of all, use your preventive care benefits. Everything coded as preventive care is paid at 100%, so there's no cost to you. Always get annual physicals and wellness checks and catch concerns early before they become major medical problems. You can take advantage of lower copays by using Anthem's Live Health Online. Live Health Online allows you to see a board-certified doctor in the privacy of your home using a smartphone, tablet, or computer with a webcam. It provides you with 24/7 access to doctors, medical care when you need it, and it's convenient and easy to use. Ask your doctor to prescribe generic rather than brand name drugs. Generic drugs can be just as effective as brand name drugs at a fraction of the cost. You can purchase prescriptions you take all the time in a 90-day supply through mail order pharmacy. Anthem will be offering improved benefits through IngenioRx beginning July 1st, 2019. More information will be coming. And you can save money by using flexible spending accounts, or FSAs. FSAs allow you to pay certain health care and dependent care expenses with pre-tax money. The key to the flexible benefit plan is that your eligible expenses are paid for with tax-free dollars. You won't pay any federal, state, or Social Security taxes on funds placed in the plan, and you can save approximately $28 to $38 on every $100 you place in the plan. The amount of your savings will depend on your federal tax bracket. Always try to use in-network providers and services, as using non-network providers will cost you a lot more money. And remember that although out-of-pocket medical limits increase for the new plan year, total out-of-pocket limits will be lower because total out-of-pocket costs for prescription drugs will now apply towards the out-of-pocket medical. So here's something really important to remember. While Henry County Schools plan year runs from July 1st through June 30th, Anthem's plan year runs from January 1st through December 31st. New deductibles and out-of-pocket limits will take effect July 1st, 2019, but out-of-pocket costs you've already incurred between January 1st and June 30th, 2019 will apply towards those limits through December 31st, 2019. So here's an example. If you have employee-only coverage and have already met your $4,500 out-of-pocket limit prior to July 1st, 2019, you will have already satisfied both the deductible and out-of-pocket limit for the remainder of the calendar year 2019. One last thing. If you have health insurance coverage through Henry County Schools and are already receiving Medicare benefits, Anthem is your primary coverage, and Medicare will be your secondary coverage. We're trying to make sure you have the information you need to make the best decisions for you and your family. There will be additional opportunities for you to obtain more information regarding your health insurance benefits through the annual benefits memo, also during open enrollment meetings, both group and one-on-one meetings, which will be scheduled between April 1st and April 12th, through frequently asked questions included in the April staff newsletter. You can also participate in a conference call with Anthem. This will be a toll-free call scheduled after school hours. An Anthem representative will provide a quick overview of the new insurance plan and then provide an opportunity for you to ask questions. It'll be scheduled on Thursday, April the 4th at 4 p.m. and the toll-free number and conference code number will be included here as well as in the April staff newsletter. And finally, you can obtain additional information on the Mark III website. And as always, if you have additional questions, please contact a member of the Human Resources Department. Thank you and have a great day.